Two more Australians have died from coronavirus, and tough border control measures are in place now to slow the spread of the disease. Those measures have come into place this morning. So from today, all travellers coming in from overseas have to self-isolate for 14 days. They'll face heavy penalties and possible detention if they don't comply with the new rules, which are mandatory. Cruise ships from foreign ports have also been banned from docking for the next 30 days. In New South Wales, health authorities confirmed that 2 more people have died from COVID-19, taking the national death toll to 5. A 77-year-old Queensland woman died in a Sydney hospital, and a 90-year-old woman who was a resident of the Dorothy Henderson Lodge also died. The aged care facility in Sydney's northwest was at the centre of one of the nation's first outbreaks. So Victorian Premier Daniel Andrews has been speaking just in the last hour or so, and he's declared a state of emergency with 14 new cases of coronavirus confirmed overnight. Victoria now has 71 recorded cases. Reporter Georgie Tunney is in Melbourne. She joins us now. Georgie, g'day. So what difference does this state of emergency declaration make to everyday Victorians?
It basically gives the Chief Health Officer, Joe, whatever powers they need to enact all of that advice that we've been talking about this morning. So you mentioned there the mandatory isolation period, the self-isolation period of 14 days for anyone who arrives in Australia. The only exceptions to that rule would be crew members, so pilots and airline staff, but also Pacific Islanders if they are in transit from New Zealand or Australia going back home. And the other measure would be to ban all events, public mass events bigger than 500 people, Joe. And this includes cultural events, sporting events, so all non-essential gatherings. That was the term that the Premier used this morning. Essential gatherings are things like airports or public transport, and schools as well at this stage are all to still go ahead. But this is some of what the Premier had to say this morning.
We are declaring a state of emergency in Victoria under the Public Health and Wellbeing Act. That state of emergency will be effective from 12 noon today and will run for 4 weeks. It is likely that that state of emergency will be extended and will be in place for as long as it needs to be. The other point to make is that that state of emergency, the provisions, the orders that are made as part of that, will almost certainly change. We will try and minimise those changes so that we can have as much consistency, as much certainty for people who are impacted. But just as advice and response in bushfires changes, so too it will change in this COVID-19 emergency as well.
And Georgie, what other advice did the Premier have?
Good judgment. That is what he is urging all Victorians to take heading into this state of emergency from now on until whenever the pandemic may end. He's talking about flattening the curve of the spread of this disease rather than eliminating it completely. He knows that that's not a realistic option. So he wants people, if they are sick, not to go anywhere, to self-isolate, do not go to work, do not go into public arenas or areas, because he wants everyone to know that if you're sick, it's better not to take the risk, save the spread to other people as well. So flattening that curve rather than eliminating it completely, Joe. He's also urged all shoppers not to hoard. He says that it is about making the most of your time when you do go to the grocery stores. Do not pack up on all of your essential items, because what that means is that if you're hoarding, it means that the vulnerable communities are not getting access to what they need as well. He mentioned that there will be some care packages available for those who do need vital, basic need items, but that what is exactly in those care packages should be released later on today.
Okay, Georgie Tunney reporting there from Melbourne. And other states and territories have increased their response to the COVID-19 outbreak. In New South Wales, tough new penalties have been announced for organisers who hold mass gatherings of 500 people or more. Reporter Lara Himes joins us now. Lara, g'day. So what's happened in New South Wales with this announcement about penalties for large gatherings?
Well, we started to get some clarification about this from about 5:30 this morning. So this has actually come from the New South Wales Health Minister, Brad Hazzard. He put out a release today stipulating that the individual individuals who still hold these mass gatherings, the declaration of gatherings, which is over 500 people, they could be facing $11,000 in fines, and there could also be prison time associated with that, dealing up to about 6 months. And that could also increase depending on how many days or the succession of days that the event might go on into. So if it's perhaps a festival, that's what you would attract higher penalties for. That's for individuals, but if there is going to be some corporations that are holding events, that could actually increase. So it's essentially almost like a base level of $11,000. So some really tough penalties that are coming there from New South Wales. There's still a bit of, still lacking clarity in terms of what the penalties would be for people who actually breach those self-isolation orders. Now, there had been some discussion that breaching that, that is something that can be enforced by the New South Wales Police. But in terms of the punishment or the penalties for that, that still remains to be seen what that would actually look like.
And I think we can hear a bit of what the Premier has said this morning.
You can let the relevant authorities know, and the police can actually turn up and enforce that person to stay home. So we do have that provision. We'll be enacting that. But if you know that intentionally someone is doing the wrong thing, we hope it doesn't come to that. I'm really hoping this is a situation where people do the right thing. We only have to look overseas to see what's happened when people haven't been able to take advice, or the advice hasn't been given at the right time, and the consequences are horrific. This is life and death. Don't take chances. Don't take chances with your own health or the health of others. And all of us who mix with elderly people in our own families need to be conscious of how often we see them and how we see them and how we support them during this difficult time, because we do know that our older people in particular are very vulnerable to this disease.
New South Wales Premier Gladys Berejiklian speaking there, and Lara appealing for people to do the right thing. But is it crystal clear exactly what the right thing is at this stage for these people who are coming back into the country and are going into this self-isolation for 2 weeks? We heard the Prime Minister yesterday talking about if you notice a worker who's come into work and they've just come back from overseas, well, maybe you could let authorities know. But apart from that, what are people in self-isolation required to do, or what are they restricted to? For instance, can they go to the supermarket with a mask and buy some food?
Well, essentially, this is where we're getting a little bit of disjointed information or a lack of clarity in terms of what surrounds this. And the other thing to remember is that it is very different depending on which jurisdiction that you are in. We've heard this morning from the Prime Minister was speaking about people who perhaps arrive off a plane and they might get into a ride-share vehicle or into a taxi, and whether or not that is permittable to do. And essentially, he's been saying that they're actually at low risk of contracting the virus there. But in terms of what self-isolation actually looks like, the direction that really people have received is only whether or not they should be staying in their own homes, or if they're an international tourist or visitor, to remain in hotels. Now, that doesn't necessarily mean how they can, it has an outline how they go and get food, how they can go and get supplies. Are there going to be punishments for that? So there is still some conjecture about what that would actually look like. And just to give you some perspective in terms of some of the figures that we have been seeing at the moment, obviously we've mentioned this morning that there are 5 deaths nationwide from the coronavirus.
So that's increased by 2 overnight.
That's correct. Yeah. Both of them in New South Wales. Now, the people involved in that, tragically, has been a 77-year-old woman from Queensland. She began showing symptoms on a flight to Sydney. She did seek medical advice. That was on Friday. She later died in hospital. And the second case has been a 90-year-old Sydney woman as well that was linked, or was a resident of the Dorothy Henderson Lodge. Now, this was the aged care facility in Macquarie Park where there have been other cases of coronavirus and also deaths recorded at that particular facility. The numbers that we're starting to get through are sort of coming through in drips and drabs, and depending on where you are, that determines when your state actually provides that. So yesterday, in terms of the total number of cases from New South Wales, it's getting up to about 140. So 134 confirmed cases. That data came out yesterday. That should be getting revised up later in the day. And just to give you a national perspective, looking at around nearly 300 cases. So that is constantly changing. We've also had some information come out of Victoria. Victoria total now stands at 71 cases. So it just goes to show you how fast moving this issue is, and how a lot of this information is changing as the morning goes on.
OK, we'll leave there, Lara Hyams.